Light, presented by Community Health Network.
Well, let's welcome in WISH TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. Dr. Adams, how are you doing today?
I am well. Good to be with you. I'm enjoying the last little bit of this nice weather.
I know. We need to enjoy it while we can. Now, you travel a lot, and I see you with your mask. So we are out of the worst days of the pandemic for COVID-19, but talk about why it still remains a public health threat and how we're often seeing rising levels of infection, especially in these colder months.
Well, the turning weather is a time of year when we know we're going to see more people coming inside, windows closed, so worse ventilation. We know that people are traveling by plane, by train, by car. And we also know that people are gathering around individuals who are vulnerable. You're going to visit grandma. You're going to see people in nursing homes. So for all those reasons, we know we're going to see increasing COVID cases, hospitalizations, and unfortunately, deaths. And that's why it's imperative that we take precautions to protect ourselves, including, as you mentioned, masking where it makes sense. But one of the most important things that we can do is make sure we're up to date on our vaccines. Yeah. Most people haven't gotten the new vaccine in well over a year. And just like we do every year with flu, we update the vaccines for currently circulating variants. People need to make sure they're best protected going into this holiday season with the new updated COVID vaccines.
And I'm happy you brought up the vaccine because there are updated ones that have now become available. So what are the current CDC recommendations for people getting that updated vaccination?
Great question. So CDC recommends everyone 6 months and older can get a vaccine, but I want to highlight a few groups. Over 65 years of age, these represent 90% of the deaths from COVID-19. So if you're a viewer who's over 65 and you haven't gotten an updated vaccine, please talk to your doctor, talk to your pharmacist, talk to your health care provider, get your questions answered, but you really need to get that updated vaccine. Also, if you're someone with a comorbidity, and what do I mean by that? Let's make it concrete. If you're carrying an inhaler around or you use an inhaler for your asthma, if you take medication for diabetes, if you got high blood pressure and you take medication for heart conditions, you are at higher risk. You should make sure you're getting your updated COVID-19 vaccine and your flu shot.
Now, some people have caught COVID recently. Now, for those people who might be recently getting over COVID, do they need to also be getting vaccinated, even though they might have recently had a bout with it?
Great question. And immunity from infection, we now know, is not enough. CDC says you should delay a vaccination by 2 to 3 months after a recent infection. Most people who got infected in that late summer, early fall surge, now's about 2 to 3 months out. So it's the perfect time to get that updated COVID vaccine. And we know that if you get that updated COVID vaccine on top of a recent infection, you will have better protection than if you didn't get vaccinated. The studies show that. So yes, even if you got infected earlier this year, you should still be considering getting that updated COVID-19 vaccine to protect yourself, to protect your family, and to protect your plans. You don't want to have to cancel Thanksgiving dinner or a trip out to go see loved ones because you've got COVID or because someone else has COVID.
All right, Dr. Adams, one last question. The CDC and the FDA accelerated the availability of additional doses of new RSV immunization for infants. What's behind that decision?
Well, a new RSV vaccine became available this year for infants. And to be frank, the demand for it was way above what anyone ever anticipated. And parents are complaining that they can't get it. RSV is a pretty severe infection when young babies get it. And so the CDC released doses from the stockpile, over 70,000 doses, to help more parents get that shot. If you're someone who's pregnant, you can still get the adult version of the RSV vaccine, and your antibodies will then protect the baby. If you have a baby who's under the age of 1 year, talk to your doctor, because this is another one of those things that can really help you get through the holiday season with a lot less hassle and hopefully with better health.
Awesome. Well, thank you so much, Dr. Adams. We hope you have a wonderful holiday season as we continue on through the rest of this week and the rest of the year.
Thank you. Go to vaccines.gov for more information on vaccines or talk to your doctor or healthcare provider.
Thank you so much.